So, a very good afternoon and welcome to all of you. Uh, we have joined in this yet another series of webinar from Parul Institute of Public Health. The topic for today's webinar is basically developmental mindset and the principles in community health. And what we are going to discuss today is basically developmental mindset, which is not anything but a pattern of thinking and a way of looking at various opportunities uh, present in the world that helps us in continuous and individual and organizational transformation, and especially talking about this present times of COVID, this present pandemic. We need to have a mindset, we need to have a way of thinking that can help us in strengthening not just our present existing healthcare, health infrastructure, but overall for improving the health of the community and the society as well. So, with that brief note, with that brief thought, I would like to welcome the guest for today's webinar, Dr. Samuel. He is from Ghana, and I'll request Dr. Samuel to take over the session from this point.
Thank you, Doc. I kindly want to share my screen with you, then we can continue. Thank you for the opportunity. Great. Please, can you see my screen?
Yes, it is visible.
Thank you very much. I want to thank Professor Rejoice and all the team members at the Public Health Institute for the opportunity to share this important topic with you. I'm so passionate about it because that is what we need as a middle income and low income countries. So as I was introduced, developmental mindset principles in community health. And why is this topic so dear to me? Because over the years, as we work in communities, seek the health of people, I think there should be a mindset, paradigm shift in the way we think. And basically, developmental mindset is a attitude and set of behaviors of which we approach our work, or we want to approach how we work in the various communities as public health experts. Over the years, in low and middle income countries, we want to look at donors, funders coming, then they give us. And in Ghana, in the northern part of Ghana, which is very poor, if you talk about agencies or NGOs which have been there, so many of them, huge investments have been there dealing with health issues. But still, if you look at it, the poverty issues have not been addressed. Still, it is the poorest in the region. And as I think through, these are some of the things I have learned over the years. And I want to share with you as public health experts, as we go out, how we are also going to change our world and communities, our countries, and all the areas we are going to work with. So basically, it is about an attitude. That is what I've seen. And also behavioral change with how we want to approach our work as we do it. The major objective is as we do some of these things or embark on health programs, projects, the essence should be self-reliance, meeting their own needs in these communities and improving upon their health. And when we do that, then there will be a sense of ownership. They will be able to own their health and be able to take good care of themselves instead of seeking for funding, just going to dump it on them. If we let them be more self-reliant and also capable of meeting their own needs. Then they are able to own their health, their capacity is built, and resources available, they are able to tap into it and becomes more sustainable than we are in need of this, come and give it to us. Sometimes their needs are not even met because somebody wrote a proposal and they just came in with those interventions. But when we have that developmental mindset and we are able to build their strength, build their capacity, they own it, they own their health, they become more responsible, and also their capacity is built, they are able to transfer those knowledge that have been acquired to their children and other community members, then it becomes more contagious, and the health of the community members are actually improved, and it becomes more holistic, it becomes total, and it is not just a session of the community members improving their health, but it becomes complete per the health definition. And the resources, though in low and middle income countries, will not be that much compared to the developed countries. There are a lot of resources which actually abound, and as they use the resources, then the ability to sustain their own community health with their families improve, and it becomes more holistic when we do that. So basically, having developmental mindset in community health is to achieve these objectives. And I just want to share with you this picture. It is a Chinese adage which I really love when we talk about developmental mindset. It says, don't just give me fish, but teach me how to fish, and that is more sustainable in terms of development. Normally, we just go give them fish. What I mean by that is we look for donors, we look for sponsors, look for the resources, just go and give it to them. And when it gets finished, they are stuck. They will be waiting for another more opportunity to actually somebody to help them. And if the support is not coming or the intervention is not coming, then people will actually be lacking or be found wanting in some areas. And so it is better we teach, as public health experts, we teach people how to fish instead of always giving them the fish. And when we do that, their capacity, as I said earlier on, is built. They become more responsible with their health because they are involved, and their knowledge is built in terms of health development. So what are these principles? I just want to share probably 5 of them with you. And the first principle is that we should not start activities that the people, and what I mean by activities is health interventions or programs which will not be able to continue on their own should your assistance be terminated as a public health expert. And what I mean by that, if you look at the picture, during the COVID time, we as an organization, we were buying hand sanitizers, we were buying nose masks, we were buying soaps for the people in the community to use, so that as a COVID protocol, they will not contract the COVID. And as we're doing this, because we just bought the items, we thought we have money, this is what we are supposed to do for the community or the community members. We bought these items, gave it to them, and using it. And if I tell you the amount of money that was actually invested into some of this project, buying of the soap, nose masks, and the rest, huge amount of money, and the people were not using it. But there's this thing that we do which was so powerful, and I want to share with you from the picture. We encourage some communities to actually use tippy taps. And as the children try to actually install the tippy taps, we are teaching them to be more innovative. And since they own it, they did it themselves, their self-confidence is built, they own it, so they will make sure it is not spoiled. And so when we went for the monitoring, you can see a lot of community members using these tippy taps because they have been able to do it. And in terms of developmental mindset, we should not start activities that the people will not be able to continue. And this one, because the children themselves are doing it, they are making sure their parents are washing their hands. No COVID case was reported in some of these communities because now they own the process and they are more self-confident. Even when the soap is finished, the children will be encouraging their parents to buy it. And so as public health experts, when we want to provide some interventions, actually we should not start activities. We should bear it at the back of our mind that we should not start activities that the people will not be able to continue on their own. Should your intervention stop? But let us involve them. And as I go on, I will talk about the tool we can use to let the people involve. And we appreciate the outcome, the kind of impact, just the installation. If you look at the other communities, there were issues, but these areas, no COVID case was reported because they became more responsible. They think they own the tippy taps, and they used resources in their communities to actually. They use resources in their communities to manufacture, which is also at a lower cost than we going to buy those expensive things and giving it to them. They probably not seeing the essence. Some of them are saying they are even suffocating, but they came out with so many locally made items to protect themselves. And I believe as COVID cases are going down in Ghana, those communities, the children have been taught to be more innovative, and their skill in problem solving has actually been enhanced. And this is more sustainable than just waiting for people to come and give them items. The second principle I want to talk about is it is important to let them start small with what they are familiar with, actually, to allow them experience small successes. Actually, when they do this, their self-confidence is actually raised, and they are able to actually meet their own needs. And if you look at the picture carefully, you can see a young girl fetching water from a stream. And how did they come by this? This is a stream where the people fetch water and they have water-borne related diseases like cholera, like a typhoid fever, like a hepatitis B, salmonella, and the rest. And as the cases were going down, they've tried to find means of actually addressing this issue. And as they engaged the community members on the way forward, they came out with a borehole. And if you look at the second picture, you can see now the people having access to potable water, eradicating waterborne related diseases in the community, like the cholera, which was going up, and other waterborne related disease. This happened because the people were actually involved, and the success of it is that after they they came with the idea that let us sell the water to the community, other community members who will fetch it, so that in terms of maintenance of the borehole. They will be able to maintain it. They won't wait for a donor to come and draw the borehole for them. But as they go and take a token out of it, they will use that money to sustain it. And as I speak to you now, they have been able to raise some money to actually drill another borehole to the other sector or the other part of the community, so that people don't have to commute long distances before going to fetch water. And I think as a low or middle income country, this is more sustainable. Now the people came with the idea, they are selling the water at a fee that everybody can afford in the community. And as they raise funds, they are even drilling more boreholes. And as they get access to potable water, they are actually dealing with the issue of waterborne related diseases in their respective communities. And I think public health experts, if we want to pursue a developmental agenda, more sustainable activities, programs, projects, then I think we should look at this principle of letting them start small and letting them be more familiar with what they are used to. And as they experience the successes, their self-confidence and morale is built, and they are able to address their health needs in the community. The third principle I want to share with you is involvement, participation, letting the community members come out and engaging them, and not just dumping our health interventions or programs in them, but making sure everybody participates in it in terms of planning. And in terms of even when they participate, we are planning, we are doing this. In terms of that, we also involve them in the implementation. And as they do that, they will begin to own the whole process. Even evaluation, let us involve them in any of the programs or interventions or any of the education that involve them. And so that as they're achieving these things, they are meaningful to them, and we don't do something that is not meaningful to them. And so that they will abandon it when you leave. They will actually use it or pursue it or do it in your presence. But because they are not involved or they didn't participate, normally when you leave them, they will actually abandon the whole thing and go back to their. And that is why, as I was giving you the scenario in northern Ghana, a lot of big NGOs have been there, billions invested, but if you still come to the northern Ghana, still they are here because some of the interventions we think we have the money, so this is what we think we need, so let us do it for you. But as we involve them, engage them, they participate in the planning, implementation, evaluation, and the rest. They become more involved. They begin to understand what we are doing, and they begin to own it and be more responsible in terms of owning their own health. And in terms of participation, what we can use this methodology to actually make sure the community members are actually involved is one is a cover methodology. And cover is a Greek word which means binding together. And as you use this methodology, you are actually one first step is that you let the parties envisioning the community, you let them reflect. So you can't call the home, but you can use focus group discussion, or you use some opinion leaders, people who can talk. You can also take transit walk with the community. As you let them know the state, you are envisioning them. This is the current state of the community. Then when you finish doing that, they get to know the reality. As they were going around the community or coming out with the current state of the community, you can see that every community has got something good, something resourceful. And so what they have identified, you celebrate it with them. You can see some of them have even a clinic in the community which they have given up on. It is not effective, but that health center in the community, if they actually tap into it and make good use of it, so they will be celebrating. For sometimes they even have a community health nurse in the community which they are not making good use of. And as they identify these personnels, they have even people, traditional people who can speak the language, can interpret it very well. These are all resources in the community they need to celebrate. And as they celebrate some of these things using the Kappa methodology, their self-confidence is built, and they begin to appreciate the communities they lead themselves as they celebrate what they have, or whom they are, and what they have in their communities. Then, as they celebrate it, you begin to engage them to envisioning how they want to see their community in the near future. What are the health facilities? What are the health things they need in the community? And so they begin to describe their communities by drawing the new community. And even in terms of drawing where they want road to be, where they want a health center to be, so that in case of accident or emergency, that health post can be accessible, where they should put the health professionals, their accommodation, so that they will be readily available at the health center to support them and provide the necessary intervention. So the community begins to draw the new community they want to see with all the necessary resources, where they are supposed to put the school, where even the refuse dump, which is contaminating their water bodies and the rest, causing outbreak of cholera and other diseases, where they want to locate it. So they describe their new community and they get more involved. So as they describe it, they get to know some of these things, where they should fix even the incinerator. They begin to list the items they now need in their new community, the new with the health background. And as they do this, they list them, they analyze them. You do it with them. You use prioritization to do this. And as you do this, they begin to own the whole process, and they now believe themselves that, yes, we can do this. Then, when they do this, now they dream dreams and take action. What I mean by they dream dreams is they actually see the new community, they draw action plans, letting people be responsible, putting people at a place. You are going to do this. This is what we are going to see the municipal assembly. We need to get leaders. We need to get in touch with these people to support us, or we need to get in touch with the district health directorate to actually come and support us in this area. So they take the necessary action. And as they do this, then they reflect on how they are doing. That is, measuring their effectiveness to see whether the interventions they have put in place are actually effective and helping them to achieve their objective of meeting their own needs and improving their health status. That is the Kappa methodology, and it is a nice tool if you want to actually have this developmental mindset set in our health profession. The second methodology is 10 seeds, and which as I was practicing this and had an encounter with this strategy, it is so nice. And it was actually initiated by or propounded by Dr. Ravi Jayashankar from India, and I really like this technique. I don't want to go into detail, but it is just a tool, a qualitative tool used in gathering information on various issues in community development in terms of health and other areas. The next principle is that we should not be perceived as taking over the legitimate role for roles of individuals and other responsible persons in the community. Before we go into the community, there are roles people are actually playing, which is very key for their development. And we shouldn't undermine those people, but we should involve them in what we are doing. And when we do that, we'll get all the necessary results, and our intervention, the trickling down effect will be so enormous as we do this. And by this, I want to show you that so as an organization, we thought it is good to provide a borehole for them. So the geologist and the team went, they sited the place. When we handed over to the community, we thought now the issue of waterborne related diseases are dealt with in the community. But still, when we went back to the health post or the health center, the district, to check, still waterborne related diseases are issues in that community. And what was the cause? In fact, where the geologists cited the borehole was actually an old cemetery, which the people felt water from that place should not be taken in. So though a huge amount of money was actually invested in the borehole, nobody fetches water from there. And the borehole has actually become a white elephant. But can you imagine what would have happened if, when the team was going to break the borehole, they have actually people that we should not be perceived as we know it all and we want to. But if they have actually involved the people in the community, I think they could have helped them to site a borehole at a place where the people will be happy and pleased to actually use the borehole. And as they use it, the issue of waterborne related diseases are actually dealt with, instead of letting it become a white elephant. Last but not the least principle is that we should not seek to avoid doing healthcare. Should be complementary to what they are doing rather than a substitute for their contribution. And that is another into a community. There are certain things people are doing. Even if we want to change it, let us involve in what. And this, sometimes I remember we went to a community where I have to even drink some of their water, which was so polluted. Drink it and let them feel that sense of belongingness. And one community, as I was drinking, they said the water is sweet. Because of that, as I drank it and I became more of them, I became part of them, and they understood I was educating them, then they began to understand why they should that water is contaminated. And as we were doing it, were weaning them from their old way of doing things, and they became more involved. And they rather supported in getting access to potable water to meet their health needs. And you actually do this. And they but going to school, but sometimes a language can even be a barrier. And as an interpreter, and they can do it better so that your work can go on very well. Thank you so much. I just want to pause here for any question, any feedback or response. Thank you for your audience. I'm most grateful. Doc, I want to hand over to you.
Yeah, thank you so much, Dr. Samuel. That was wonderful. Very nice presentation. Very uh, wonderful description. Overall, it was very much pleasing. Uh, any questions? Any comments from the audience? Anyone would like to?
Dr. Samuel, you have nicely presented everything along with the methodology. The one methodology, our methodology, this is actually not very frequently used in our country. So, how frequently you have find um, this methodology being used over there in Ghana? Or have you come across many literature using this Kawa methodology in research work?
Yes, as we work, as the organization we work with, we use it a lot, and it is part of our community entry, and it has been so impactful. As we enter the community, we use it so they understand where we are coming from, that we are not coming to take everything away from them, but they are very, very important and key stakeholders in what we want to do in terms of even sustainability. And when they understand it, the results has actually been amazing, because they really, we go back projects we have done about 10 years, 5 years ago, because now they own it in terms of ownership. They are still working. And even as I cited an example of a borehole to deal with waterborne related diseases, when we went back, they have even raised some money from the little money they get, and have even drilled another borehole in another community, so that they will keep on having access to potable water. So most frequently we use it. Thank you, Prof. I hope you are answered.
Yeah, thank you very much for that. But I'm still interested to know whether this is like a etymology type of methodology, or something different, wherein people in etymology, people they used to stay in the village with the people after making a good rapport with them, and then they study the whole community.
No, it is a methodology, more of a tool. As you enter the community, you are using it. Even in terms of the meeting, that is like a process. First,
Okay.
this is what we are going to use. So you use it as a tool, involving them as you enter the community as health professionals. They are more participatory. It is a participatory tool.
It's
So they
participatory.
begin to, yes, and reorient them what you want to do. So more participatory. Um, if they are not involved, you can't do it. I think that is what I would say.
Having collected all the information from the community, how do you enter those data in data form and analysis? What tools you might be using for the analysis of this information?
Okay.
Pardon?
So with regards to the analysis, actually the analysis is done with the community members, the people you have selected, the stakeholders, the key people in the community, you involve them, and you can use the problem tree analysis to actually about if it is a health issue, what is it? What are the problems of that? So we use the problem tree analysis to actually do it. You can also use the SWOT analysis to actually do it
Okay. Okay.
to
Wonderful.
help
Wonderful.
them. So they, and as you are doing, yeah. Thank you,
That's
Prof.
fantastic. Thank you. Thank you very much. Nice. Very nicely explained. Thank you. Thank you, Dr. Sanjay.
Thank, thank you, Prof.
Doctor, hello.
Yeah. Hello to Vaibhav. Yes.
Yeah, yeah.
Please
So,
go ahead.
Dr. Samuel, I would like to know a little bit about the various development sector related challenges pertaining to the COVID, especially when we are talking largely in India about immunization, and there are immunization drives across various health across various age categories in India. So, how is I would like to have a quick glimpse based on your years of experience and your expertise in the public health sector, how the government is dealing with the immunization and tackling the COVID scenario in in Ghana.
Okay. Thank you, Doc.
Hello.
For the
Yeah.
president. Hello.
Yeah. Now we can hear you.
Yeah, I said our president in the midst of the COVID, and they don't. And for me, I think that is a profound statement he made. So what that means is that the government was very, very active in terms of even lockdown, in terms of even ensuring that the COVID protocols are really observed or adhered
Right.
to by wearing of nose masks and making sure when strong adherence to the COVID protocol was really, really observed. And as I speak to you now, the COVID case the head count is slightly over 1,000, which is actually going down. So the first thing I will tell you is that strong adherence to the COVID-19 protocols was really observed. And as I was speaking to you, these are some of the things we also did at the community level. And the second one is, yes, we have over 600,000 COVID vaccines have been administered to the aged and the health professionals who are the frontline workers have been administered, and they are even going for the second dose of the COVID-19 vaccine, and more of them have been procured, which will be in the country this month, and it will duly be children are not being vaccinated yet, told you, and the health professionals, the frontline health workers have all taken the vaccine, and as they have a plan. The Ministry of Health in Ghana has a plan where they want to roll it gradually to cover all the citizens. Thank you, Prof. I hope you are answered.
Yeah. Thank you so much for explaining. Thank you so much, Dr. Samuel.
Yo,
May I request audience if they have any question? Now is the time. Okay. I suppose at this moment the audience do not have any questions. So yeah, thank you so much, Dr. Samuel. We have a very small token of appreciation waiting for you in the form of a certificate, which will soon email it to you. Ideally, we wanted to present you at this moment, but anyways, we'll email it to you. So thank you again, heartful gratitude again for sparing your time and this wonderful presentation. Thank you so much, Dr. Samuel.
And another important announcement, I think Dr. Vaibhav, all those who
for
are
the
presenting,
opportunity. Yeah,
sorry,
most
all those candidates or scholars who are presenting webinars, we are issuing them a certificate of appreciation for presenting the webinars online. Isn't it?
Yes, yes, yes.
So we look forward for all of you to present as many webinars as possible and fix up the time with Dr. Vaibhav or Rejoice sir,
Sure.
right?
Yeah.
Yeah,
Okay.
thank you.
Okay. Thank you so much, Dr. Samuel, again, and thank you all the uh, audience who have joined, spared their time for today's webinar. Okay. So we'll end this webinar now. Thank you.
thank you.